Mr. Beining is the Van Buren Education Association president for our teachers union.
Basically, we sent a survey out to all of the teachers asking their opinion on masks. The results I got back, I sent you guys an email with that information, but 20% of the staff said yes, mandate masks, 80% said no, leave it as an option. Something I wanted to add too is when you're walking around the buildings and looking at the kids and the staff, just rough guesstimate in the last week information I've just counted as I walked around, I would say about 20% of our students wear a mask. Not always right, but they have a mask on. And about 15% of our staff wear a mask. Just rough for your information, what I've seen. The other thing I put in the survey was on how we're handling COVID as a district. 50% of the staff said fantastic, could not be handled any better, which that's what I would be in. I think we're doing a lot of things correctly. 43% said we're doing an average job, and only 7% said we're doing a poor job. That was out of the 55 union members that were polled.
A representative from our Van Buren local 783 couldn't be here. They did pass along a letter, so I was going to read it for them. So it says, "Good evening to all. We have all been dealing with the additional stresses the COVID pandemic has brought into our lives now for some time. These complications affect our lives and families in individual ways that we never anticipated. We each deal with the difficulties in different ways and have personalized ideas of what is needed to lessen the impact of these issues. The people represented within our bargaining unit are no different than any others in this matter. All of us make the best choices we can to maintain as normal a lifestyle as possible. Therefore, we as Local 783 will not endorse any mandate to perform an action or not to perform an action. We do endorse in this matter the rights and responsibility of all Van Buren staff and parents to make the decisions that best fit their beliefs, ideals, and needs of their family on an individual basis, as these rights should never be infringed upon. The enforcement of any such mandates of any kind will have a negative effect on the morale of staff, students, and visitors who come to Van Buren schools for events. Also, as Local 783, we would like to thank Mr. Brian Bloom for all the effort he has put into learning about this virus, keeping up to date on the details, meeting with the health department, and countless other items involved with COVID. He has been a true leader and kept everyone informed, moving forward in the same direction. Professionally and sincerely, Michael W. Trout, President."
Okay, one of the things I forgot to mention was we realized too, I know a comment was made tonight about the airborne. You know, we wash our hands, we wash the desks, we wash the surfaces, but we realized too that it's airborne. So one of the things we did almost immediately was we removed all the filters from all of our air handlers, the VAV boxes, and anything that had a filter in it, we removed them. And we replaced them with it's called a MERV 8. It's a tighter particulate. So it helps to filter the air better, right? So we also went in at that same time and we cleaned and sanitized all the air handlers. We continue to do that on a regular basis. The recommendation for the system that we have is once a year to change the filters, or it says check the filters. We actually are changing them twice a year since COVID took over. We sanitize them before we put the new filters in, pull the old ones out, and we throw them away. I also met with a company yesterday to talk again about an ionization process for all of our air handler systems, just to see if the price came down. It's really, really, really expensive. And we talked about it a couple years ago, so we wanted to revisit it again to see if it's become an option for us. So I think that's an important thing that is helping the students too.
It's your choice at our school, and that's important to my kids. My kids have both had effects from wearing it. My daughter, she is it affected her psychologically. She said, Mom, I don't ever want to stop wearing these masks because I don't want people to see me anymore. Like, she got so used to hiding behind her mask that that was her normal. And I think that's really sad. And then my son had a physical problem with it because he would come home every day from school with headaches and take naps. And that's super abnormal for that kid to do that. And he's never done it since. So it really affects people. I think you should be able to wear it if you want to and not if you don't. And as far as helping anything else, I think cleaning the desks a little bit more. I know our high school is only cleaning the desks once a day, but yet kids are coming in every period, sitting in the seat somebody was just in. I think wiping them down would probably be helpful. And I know the kids don't have a lot of time to get from class to class in a day. They're not going to go to the bathroom and wash their hands. Maybe we should take a little bit of time out of certain periods of the day where half the class goes and washes their hands at a time, just so they are getting actual good old-fashioned hand scrubbing in. I know with the sanitizer and stuff, but sometimes just washing your hands is best also.
Myself. So
Can we have comments like at the end of the forum? Can you stay to make comments?
well, I would really like to speak what I have to speak, if that would be okay. Thank you. First off, thank you for allowing us to come to this forum, kind of speak our minds and, communicate. I think that's collaboration is a big thing. I know, working for the hospital, communicating with one another, understanding each other's grievances and how we make next steps forward is, a good idea. But I'd like to start standing up here and advocating for a parent's right to choose. There is no statewide or federal mask mandates anymore, of which the CDC has come out and revised their own stance on masks. Mandates in general are starting to be deemed unconstitutional per the Supreme Court, and lawsuits are being made and won all over, even in our state. Masks are also considered a medical device per the FDA, and the school cannot practice medicine without a license to do so. Due to this, a school cannot enforce wearing a mask, period. Please see the Ohio Revised Code 4731.41. The CDC guidelines now state that the only true effectiveness are N95s and KN95s. Cloth masks are not working to prevent the spread of viruses, and surgical masks are better than no masks if they are used properly. They do not work. I can attest to my own child coming home from school with a wet mask on her face. This is more dangerous not having one at all. My wife actually took the liberty of taking a sample from my child's mask, and a toilet seat at the local college, and putting it under a petri dish. The mask had more bacteria and growth than a toilet seat. At this point, knowing everything we know about masks with the new CDC regulations and hospital guidelines, I would greatly urge not to overstep parental rights of their children. As Board of Education, you should all be aware that the rights of parents are protected under the Ohio Constitution, Article 1, Section 1, 2, and 7. And dropping off my children to school every day and being at various sporting events and such, I can tell you the amount of children, staff are choosing not to mask them or mask their kids. Masks should always be a choice left for children, especially when only real way they work if worn correctly, which we all know is an unrealistic expectation. Also, if the concern about having enough teachers and staff is a concern, Patrick Henry schools and their health department had decided to stop contact tracing. Maybe this is due because the Omicron has mild cold-like symptoms or flu-like symptoms. COVID-19 is here to stay. Viruses will mutate because that is what they do. I would urge our school to talk with the health department to stop this contact tracing. If the symptoms are no different than flu, why are we not treating it as such? I'm sure you are aware there are lawsuits being filed through Warner Mendenhall against school districts, school boards, and superintendents in Perrysburg, Springfield, Avon Lake, and for these very reasons, enforcing unlawful quarantine and segregating students in addition is unlawful masking. The Mendenhall law firm has already won such cases in Cincinnati, Ohio, University, and other lawsuits across the state are suing health departments themselves. By enforcing mask mandate, if that is what is decided, you're opening yourselves up for a potentially bad legal situation which would plague our school. I would just not assume parents in this district will sit back and let parental rights be stripped away from them. Also, in following the numbers out of Van Buren, I would like to state, as this young lady has said over here, we've only had 15 positive children at this time. I do appreciate the fact that the board and what they are trying to do to prevent the spread of this more contagious but less severe variant of COVID. I also realize it has put you between a rock and a hard place, so to speak. But this variant is so much less serious that the CDC has compared it to flu-like symptoms. and have lessened quarantine time to 5 days if symptoms are improving. We never masked our kids during flu season. The most that has ever happened was schools closed for a day for deep cleaning. And they were all right. And they were all right back. No matter if you were vaccinated or not vaccinated, masked or not masked, we can still contract and spread the COVID the same way. Despite all the different views out there, one thing is fact. We're all trying our best to keep our children safe. And my hope is, in a world where everything is so uncertain, we can all respect each other's views and continue to leave the choice up to the parents. Thank you for your time.
I'd just like to say, yeah, I think it should be a choice. You know, if you want to wear a mask, great. If you don't, you know, it's a democracy, you know, like I think it should be a choice. And then I don't know if we're kind of the exception, but we haven't worn a mask probably since the middle of 2020 or had vaccines, and knock on wood, we never had it.
I have a friend who is in the Bowling Green schools, and they were informed that the new Omicron variant was very similar to flu-like, and a lot of the kids they were seeing were having 24 to 48 hour short-term symptoms that were similar to flu and maybe just a low-grade fever, and that they were encouraging kids to stay home for about 3 days and then return to school. So I thought that was interesting that they actually had a set protocol for what their expectations were. And I think
when you bring a study forward, you have to bring both sides. Here's what doctors are saying, or doctors saying about good thing about masks. Here's what they're saying not so good about masks. Here's our evidence to both sides. You make a decision. In all American history, even history in general, forcing something on somebody has never ended well for that other side. Never. And I will stand till the day I die and use scientific analytics to prove that, whether before or after. I'm willing to listen to both sides. But when you're bringing something, you need to bring evidence to both sides and let people make a choice for themselves.
Thank you. That's exactly what I'm saying. You're absolutely right. And that's what I'm asking, everybody here to look at all the studies, not just the couple that will fit the narrative here. It's very important. And the gentleman brought up a lot of legal issues. I'm not going to go into those. I'm not a lawyer. I don't even play one on TV. I'm going to stick to what I know. And those needs to be sorted out with, with the legal community as well. Again, I have those studies I'm willing to share, and then you guys will make your own decisions. I hope we will never get to forcing anybody. It's not about forcing. It's about talking to each other and say, okay, you know what? If we have 99% of the people at the hospital and 99% of the people who are dying are not vaccinated, are not boosted. And you know what? I heard a lot that there's a lot of, this virus evolved for 2 years. Science changed. At first, we were kind of really stressing the need for cleaning the desks and everything. We found out it's mostly in the air. It's not. It is a little bit on surfaces and stuff, but that should not be our first one mitigation. Our number one mitigation should be to stop that virus that's in our airways to get into the room, to get into a closed room, to protect each other. If I'm asking, and you know what, on meetings with the supers, all we're asking is not for a change in policy that's going to be infinite. It's just put a time on it, put a metric on it. If we go above 20% of the cases, we'll go into this mode. If not, we'll drop automatically. Make some of it as choice. It's between you and the boards to discuss that. All I'm saying here, we're providing the evidence that masks do work, vaccine do work. And again, this is a good discussion because we want to hear everybody. I'm going to give you my card and my phone number and my email as well. Please reach out to me. I will have a discussion. I will show you what I see, what I'm reading. You guys all have full-time jobs. You have families you're busy with. That's my full-time job. I do look at the data, and that's how we make decisions. And that's how I want all of you to make decisions for your family. And I want all the boards to make decisions for their schools as well. Look at the data. It's very important.
Okay, so you said look at the data. All right. Look at the data in Uttar Pradesh. If you want to talk about vaccines, look and see how many people have survived in Uttar Pradesh with COVID and how their COVID rates have dropped compared to, let's say, Israel, who's been pushing their 4th booster right now. I'm kind of going off the cuff here. I didn't write nothing down. So when it comes to masks, with what this lady over here said about the Petri dish, basically, and Ryan back here about the Petri dish on your face. The point is that with children, like she said earlier, with the on the desk and all over the place, and we're not a doctor by any means, but where bacteria seems to grow is in warm, moist environments, and that's exactly what's underneath that mask. So I think we have a pretty good idea that we're not for it whatsoever. But I guess I kind of wonder, because I didn't realize we're going to be getting into vaccines and all that conversation today. I thought it was just going to be about our children and masks. But when it comes to the vaccines, like I said earlier with the Uttar Pradesh, I just don't see what's at stake if you write a prescription for ivermectin, which is, I guess, big forbidden and shunned. What is there to lose? You know, if you have people dying left and right from COVID, supposedly, what's there to lose if you just give it a shot? It starts with you guys. You're the doctors. Why can't we just try it, see what happens?
Well, I guess that's a fair question. There is, and I'm sure, as Karim said, you have, or some of you have data. There's been trials done. It is not shown that it's been effective. It has significant side effects in some people. So it is a risk benefit. We don't carry it on the formulary at the hospital because it's prescribed for what it's used. Isn't something that we've seen any cases of. But I do understand what your question would be. And there's a lot of those different kinds of things that people ask about. And we'd like to think, as Karim said, that, and we are not always able to do that, to have looked at a trial that has shown that it's effective. I can talk to you offline if you want to talk about ivermectin, because we've had our doctors look at that and we've gone through. But that's specific on one. We talk about hydrochloroquine. You can talk about probably any medication you want to pick out a vitamin. There's been lots of studies being done, looked about what to use. I mean, I think from a medical profession, if we thought it would work, we would use it. We're not opposed to using anything if it would be helpful. So that would be the standard answer. The question was about natural immunity. Well, I think natural immunity is fine. If someone has had this, that they're going to have some natural immunity. There's a couple things I'd say about natural immunity. One, it's probably going to last for 6 months also. So unless you're planning on getting it again, the problem not about natural immunity is if you're comparing it to the vaccine, you know how much antigen you're getting. Not everybody that gets natural immunity gets the same antibody response, because not everyone had as much infection. So it's, let's just say, a little more inconsistent. But I do think natural immunity is good for people. The problem is that some of the people that get natural immunity from getting COVID get long COVID. They have problems. It's a misconception in my mind to say, well, this is just a cold or an influenza. It's mild. Not everybody gets over it. It's just kind of accepted. I'm going to get over this. If I don't get real sick, I'm going to be fine in 7 days. That is not true. They're in the hospital. Kids are down in children's. Those are the things that happen. It's not that common, but it does happen. That's not what we've seen, like I said, with vaccines. We haven't admitted people that have had vaccines.